And the body's so resilient, it can withstand all kinds of abuse for years and years and years and years and years. But then eventually you got to pay the price. Eventually you got to, there is a price to pay for having bad habits. And it's not that complicated. It's like any other machine, just a biological machine. You've got to use it in the way that it was intended to be used, and you got to provide it with the fuel that's required for it to run optimally. So using it the way it needs to be used is moving it around. Since it's biological, it needs stress needs to be applied to it. It needs sleep and recovery. It needs good nutrition, and I think that would solve the vast majority of health problems. All right, today we're here with Dr. Megan Ye. She is Peter Ye's wife. She is a co-owner of Starting Strength Columbus. She's a physician. She's a professor. She's a lifter. We're going to get to know Megan today. So Megan, welcome. Would you mind giving us the down low on your medical background? And then I want to talk to you about your numbers under the bar.
Sure. So happy to be here. So I'm actually an assistant professor of clinical medicine at Ohio State. So I am an internist by training, and I work as a hospitalist, which for those of you that don't know is kind of like your primary care doc when you're admitted to the hospital nowadays.
Got it. Okay.
So I see all different types of patients. I have some of my own patients. I work with consultants. I work in all the hospitals we have, so cancer, cardiac, rehab, and just the general hospital as well.
Well, maybe we can start with some education right out of the gate, because I'm not familiar with what a hospitalist does. It's always occurred to me that when someone goes into the hospital, there should be someone that is responsible specifically for that person's care. And it's never seemed to be that way for me anyways. I've had a few run-ins. Is that what that is? Are you the one who's responsible for ensuring the patient gets care and is managed from start to finish?
Correct. So most of the times when you're getting admitted to the hospital for a problem, I'm the person that's seeing you down in the emergency department. I'm putting in your orders. You'll go under my name, so to speak, and I'm responsible for you while you're there. I determine if you need, extra consultants or other people to be involved in your care. And then ultimately, when you're better, I make sure that you get where you need to go, whether that be home or somewhere else.
Let me hear about your numbers. Where did you start? How long ago was that? And where are you at now?
So I started when I was, I guess, September of 2020. I started a month after I had my second child. And literally my husband and I were just getting into Starting Strength, didn't know anything about it. And I felt I had an injury before. I had thrown out my back during my pregnancy, and it was pretty bad. And I knew I needed to get stronger. But I didn't have a whole lot of time then. And so I literally started with 45-pound bar, and just kept, adding weight. And I think after, several months, maybe January, February, I was up into like the 170s, 180s in terms of a squat. I think I was deadlifting over 200 pounds. But by that time, we also really knew that we were doing a lot of the movements wrong and needed some help, needed some coaching. And that was when we were getting into, thinking about actually starting the gym. But progressing on now, I lift 2 days a week. My schedule is often kind of erratic, but now I squat consistently in the 230s for top sets. I'm deadlifting 300 pounds. I bench 145. That's my PR so far. So
nice.
And my work sets are pretty close to that. So
yeah. What's your press like?
My best press is 110. Usually I press anywhere in the 95s to 105s for my sets. I find it's hard to go up, especially with the bench and the press, because I just don't do them a whole lot.
Yeah.
Usually, once a week, twice a week, when I'm off work. So
You're still
hard to
strong
make
as
gains.
hell. I mean, anything
Hmm.
above 100 pounds on the press and in the 150 range on the bench, that's sticker territory.
Yeah, yeah. I've been pretty happy. I've been working real hard at it, but
Hell yeah. Well done. I like women that lift. I think it's cool to see a girl put 2 plates on the bar and squat it. And I like doctors that lift. So thanks for blazing the
me too.
trail in both categories. Do
Thanks.
you, what's the crossover like? Um, do you discuss strength training with your patients, or is that not appropriate for your role in the emergency room?
I do, to a certain extent. I think, like anything, it's for people that are open to it. If I'm sometimes I'll wear a starting strength shirt to work, so they'll ask me what that is, or what I do. And so that's always fun. And I think it's something relatively new to most of my patients, something that they've never heard about before. Honestly, most of my patients, I hate to say it, but most of my patients don't exercise, much less are we talking about certain types of exercise. My colleagues are actually the harder sell when it comes to trying to convince them that strength training is something they should be doing.
What's the objection?
I think a lot of it is what is taught, high reps, low weight,
Yeah.
or you're going to hurt yourself, sort of nonsense.
Wait. Hold on a sec. Let me just stop. I need to think this through. Megan, you mean to tell me that your medical doctor colleagues are unable to see what's directly in front of them because it contradicts what they were taught in school?
I think for some of them that is the case. Yes.
I don't believe it. That unfortunately is the hallmark of your profession in 2023, which is man, it's so disappointing because becoming a doctor was the thing to aspire to when we were kids. What the hell happened?
Hmm.
And now we have a bunch of ideologues who have belief systems and are anything but scientific minded. Um,
Hmm.
am I nuts for thinking that, or what's your perspective from the inside?
No, I think there are certainly people like that. But then on the flip side, there are certainly doctors that do use their brain and are very good.
Hell yeah,
Um,
good.
so I think, you just have to find one of them. And sometimes that can be a little bit of a challenge.
Yeah,
But I do think there are certainly people that know the benefits of strength training or are willing to listen to that and to promote that. But unfortunately, yeah, we do have a lot of people that I think the more and more you practice, the more and more things just become routine. And we often forget why we're doing things or why we're recommending things. And we really need to revisit that these days.
do you guys hear that? We often forget why we're doing things. I think that's well said. Very 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 succinctly put, but quite a bit of meaning and consequence behind that phrase. Yeah, Megan, if you want to get one of your colleagues on the show, I would love to talk to somebody that doesn't think this is a good idea. Just because I'm just curious. I just want to know what the point of view is, because even the damn CDC guidelines say that you should do strength training twice a week. They don't tell you what that
Mhm.
means, and
That's exactly right.
right,
I think that's the problem, right?
sure,
We're not prescriptive enough with what that means.
right,
Um, and I can agree. I don't know how a patient is supposed to know what the heck to do because they tell you you can use weight machines, you can use your own body weight, you can use this or that, but um, you're going to spend a lot of time on those things, but they're not going to be near as useful as picking up a barbell
sure, sure.
for a variety of reasons, which we can get into. So, I don't have all the time in the world to spend exercising. I wish I did.
Yeah,
But if I want to train, for me, I want to do the most efficient thing. And I
yeah.
think doctors need to know a little bit more about what appropriate strength training is. I think most doctors are just like everybody else. They're busy. They
Hmm.
have lives and kids and obligations. And, it's hard enough for them just to fit any sort of exercise in as well, much less strength training. I think strength training is often the forgotten child,
Yeah,
to
it certainly
cardiovascular
is.
exercise.
It certainly is. It is ass backwards like most things in modern society, it seems. Um,
Hmm.
what is your position on strength training as a medical professional? How would you articulate the benefits of strength training to someone who is coming to you for a medical opinion?
Sure. I think it's something that everybody should do. And I think as you age, it becomes even more paramount to maintaining your health and your physical functioning. And why do I say that? I think it's largely because of the changes that take place with aging. So I think most people don't realize that you kind of reach the peak of your muscle mass, your lean muscle mass, and also your bone mass by the time you're in your late 20s to 30. And from then on out, you are steadily losing lean muscle mass, usually about 5 pounds per decade. And you're also losing bone density, usually at a rate of about 0.5 to 1% per year. And then women have this even bigger drop off when you get to menopause, which is around age 50. So I think because of those two things, say I went from 30 to 70 and I lost 20 pounds of lean muscle mass. That equates to physical strength, but that also equates to physical functioning. That also equates to your metabolic rate declining, because most of our basal metabolic rate is due to our lean muscle mass. So if you lose that, basically people aren't functioning as well. They're developing worsening insulin resistance. This is the whole reason we say people become more insulin resistant as they age. They're more susceptible to these, dangerous health outcomes like metabolic syndrome, like diabetes. And again, overall functioning, I think that's what people are looking at. Your function declines. Same thing with your bone mass over time. And so I think if you're not doing something to counteract those age-specific declines, you're going to end up to the point where you can't do that cardiovascular exercise that you want to do, where you aren't able to do the hiking and the enjoyment of retirement that you want to do, because your strength is not where it should be. And you're also not going to be as resilient when you do get the inevitable injury or illness that comes with aging.
Shit.
Um,
You after you saying that, I feel like our owners should all be medical doctors because that was convincing. That's perfectly said. I'm assuming none of your colleagues have an issue with the way you articulated that. They probably just battle with you when it comes to implementation. Is that correct, or would anyone take issue with what you've said?
I don't think anyone would take issue with what I said. I think it's more the implementation, how you maintain that strength. It's certainly proven that doing something in terms of strength exercise is better than nothing. So you look at strength overall, and people that perform some sort of strength exercise, their all-cause mortality from any cause is about 15% less than the average person. And if you do strength training with cardiovascular training together, you're about 20% less. I think the studies that we use in medicine it's hard to do an exercise study. People drop out. People don't want to do it. It's hard to get enough people that it's a generalizable study to the larger population. And there are very few studies, honestly, that have tested patients on a barbell. Very few.
Sure.
But even people doing, like I said, little dumbbell weights and resistance machines and stuff, that is the data that overall your all-cause mortality is going to be considerably lower than the average person. So
Yep.
I think, for people like us, I'd love to study the populations in our gyms, because I'm sure it would be even better.
Are you involved in the research side at all, since you're also a professor?
I am not. I usually, if I do anything, it's usually more clinically related and kind of hospital throughput outcomes, but I don't do any bench research myself.
Gotcha. Yeah, I was curious about the way the research world is going down these days. I have some peripheral awareness about the sources of money and the incentives and the stuff that is studied versus the way it isn't studied, the quality of the studies being done and the qualities of the quality of the journals that they're being published in. Do you follow this stuff closely at all? Do you have any opinion on any of that stuff, or?
I do. I think in general, you can kind of say that conditions that are more common are going to get more money and are often well-funded, heart disease, diabetes. But there's certainly a lot of bias that goes into all of that, right? Because you now have drug companies that are marketing directly to the consumer with all these commercials. I mean, you can't watch TV these days without seeing a commercial for this or that drug. And that's because that marketing works. People actually ask for this specific drug or that specific drug. So, and I think drug companies ultimately make money by having drugs that are effective or seen as effective. So I think a lot of times you are getting a lot of bias in some ways. But at the same time, there's a lot of other conditions, say like infections, that we've rarely developed new antibiotics for in years, because it's just not a huge moneymaker.
Yeah. Yeah. So I see what you're saying when you say that the most common conditions are the ones that get studied, with the caveat that the solution is profitable for the people funding the study, and for the people providing the solution. If the solution isn't profitable, it's probably not going to get studied. I think a good example of this is, I'm not sure if you're following the peptide space at all, but BPC 157 is all the rage. I've got a close friend of mine who's suffered from IBS for years, and BPC 157 did the trick and also helped him with some joint pain and stuff. And it's a pretty clear cause and effect. And a lot of guys that are interested in solving their own problems outside of the standard medical protocol are well aware of this, and it's kind of tribal knowledge amongst those of us that care to look at things ourselves. And I just fear that simple solutions like that may never get the attention they deserve, because you can't make some exotic patentable drug that a Pfizer or a Moderna can profit heavily from. Is my perspective as an outsider skewed, or do you think I'm relatively on the right track?
I think you're on the right track with certain things. My husband often talks to me about, testosterone therapy and, why that's not more generalizable to the masses. And I just don't think I don't think there's enough, definitive data that the medical establishment is going to rely on to say, this works at this level, but not at this level, et cetera. And I don't think there's as much in the way of profit. I think it's a dicey sort of subject. So I'm just not sure that that's ever going to get studied again.
You're exactly right. Because isn't it the most beautiful circular reasoning? Well, we don't have definitive data. Well, did you study it? Well, no. Okay, well, who's in charge of determining what gets studied? So you didn't study it, so therefore you can't say it's true, so therefore you can't prescribe it to me. Meanwhile, it's got nothing to do with the fact of whether or not it's true. So it's just, it's just so limiting. I wish the incentives weren't so perverse. And really, this is the function of bodies like the NIH. They're the ones that should be incorruptible in a perfect world and doing studies on things that actually are in the public's best interest, and not with that caveat of, and a pharmaceutical company can make a killing off of it. And the word killing has a double meaning in some cases, unfortunately. Let's get off this deeply troubling topic for a minute here, and let's go back to your pregnancy. So you were saying you were having some back pain. Tell me about that, and let's hear how things went after you healed up from the delivery and then started training.
Sure. So that was actually the second time I had slipped a disc in my back. So right after high school, I was an athlete in high school, and I started running. And then in my early 30s, I got into running half marathons and things. And I think after one of those was the first time I threw out my back. It wasn't too bad. I was able to kind of get back to things really quickly. Never had to see anybody for it. But speed ahead, I had a couple kids again. And I was just literally, at this point, I was pregnant with my second child, and I was bending down to pick up my daughter. And I just felt something go. And at that point, I was 32 weeks pregnant.
Oof.
You can't take any NSAIDs or all the good things.
Oh, you poor thing.
The doctors won't let you. So I just sat for a week and a lot of pain. It made the delivery seem like nothing.
Moms are so tough. All you dudes that think you're tough. Go hang out with a pregnant woman.
But I think by then, I knew I wasn't doing anything but running, and I hadn't done anything like that for a long time. And I think over time, I knew that I was just not as strong as I should be, and certainly not in some of the right areas. I had kind of lost any sort of strength training whatsoever after having my first child. And I think my back was really weak. Honestly, when I started strength training, I still didn't really know how to set my back in a deadlift. And I remember going to the seminar the next April, and I fear I made one of the apprentices that was going for their SSC fail because they just couldn't teach me how to set my back.
Nope. You didn't make them fail. They made themselves fail by not being prepared.
And, yeah, it was.
If you can't get a female, because women have bendy spines typically. So if you can't get a normal body weight woman to set her back, that is a coaching problem and not a training problem. So you can relieve yourself of that guilt. All right.
Thank God. But no, I mean, the funny thing was, the stronger I got, I think one of the great things about strength training is that I can feel muscles that I have never felt before. It took me a long time to be able to feel my lats, to be able to, feel some of these muscles that I'd never moved. And I think that's because they were just not ever exercised before.
Yeah.
And, as I got stronger, I didn't, I think I had one kind of back tweak with a deadlift while I was initially starting. But other than that, my back feels great now. And I don't have the pain. I think my flexibility has gotten a little bit better, which was a major thing that I lost with the first time that I slipped a disc. And I think mentally, I don't have that worry that something's going to happen again in the future.
That's huge.
And that's honestly more of a relief than anything.
Yeah. When you sign up for a clinical trial, for example, one of the main questions they ask you is, does this affect your quality of life, or do you fear that there might be a negative outcome because of this condition that you have? And that psychological load is a serious burden to bear. So, well done on taking steps to improve your situation. Having a strong back is great. I've suffered from back issues my whole life. I was in a sledding accident when I was just a kid, and never had a diagnosis or anything, but I walked poorly for several months. I couldn't jump for over a month. Something, I don't know what I did back there, but that was the beginning of a lifetime of back problems. And my back still isn't, it's definitely not perfect, but I know I can feel that the muscle surrounding my spine is protective. And I'd hate to imagine what sort of condition I'd be in if I didn't have a big, strong back. So applies to all human spines, male or female. You've got this, we're bipeds. You've got all this load on these vertebral discs, and you can support that load with a nice thick scaffolding of muscle, and that applies to both sexes. And that's protective and improves your function, and is nothing but positive as far as I'm concerned. So having a strong back is crucial. And if you deadlift with your hips high, you're going to get a lot of work on that back, because it's got a whole big range of motion to go through as you extend your hips. And if you do the same and bend over in the squat, you subject your back to quite a bit of load and moment load at that, and then you've got to overcome that and keep your back in perfect rigid position. And then over time, it gets stronger because the function of your back muscles are isometric. So you keep your spine in perfect anatomical position by engaging your back muscles isometrically, and then you slowly increase the load over time, and lo and behold, your back gets stronger and life gets better. So this is one of those things I wish the medical community would understand, because, I mean, what percentage of, I actually knew at one point, like what percentage of sick days were caused because of back pain. It was in the double digits. I don't recall offhand. The amount of suffering that people endure, the number of people that have become addicted to legalized heroin as part of our wonderful medical system. is significant due to back pain that is probably resolvable in a lot of instances. Do you have
Mhm.
any reflections on how you've solved your back problems versus what you're seeing every day in the field? And I also note as I asked you this question that one of the main problems is that other phrase loaded with meaning that you dropped on us, which is most of my patients don't exercise. Most of my patients don't exercise. That's not a
Mhm.
coincidence. But so that aside, what do you see? Because as an outsider looking in, it feels like this should just be prescribed. I prescribe you need to go deadlift at least once a week, and here's a gym nearby that can do it safely for you.
Yeah. We don't do this well, I don't think, as a medical profession. Uh, very commonly, I think the thing that irritates me the most is when one of my lifters says they're having a tweak, says they're having some pain in a joint or something, and they go to their physician, and their physician tells them, may take x-rays, you have a little arthritis there, you should stop. You should not do this anymore. And you should rest. That drives me insane because people are not going to get better. You're not going to physically improve yourself unless you do something that is um, of an intensity that is going to drive an adaptation. And so, the most common thing physicians will prescribe for people is walking. You have to do a heck of a lot of walking for a long period of time at a really fast rate, and you're only going to get so much benefit out of that.
It's not going to make your back
Um,
stronger.
yeah, and it's just not going to work,
Yeah.
right? If you're a, perimenopausal woman and you're losing bone mass, you're going to have a fragility fracture in your back or your hip, most likely. Those are the places that cause the most morbidity to a woman. You
Yeah.
need to do an exercise that is putting a load on, the muscles of your back, the muscles of your hips and your glutes, where you're actually going to put a stress on that bone to increase bone turnover and cause new bone formation.
Yep.
And you can't do that unless you're doing an exercise like ours. I mean, that's the great thing about a barbell. It's you can infinitely add weight. It's a compound lift. You have to involve numerous muscle groups, and you have to balance all the time while doing it, which helps you in other ways, helps to prevent falls as you age, all these things. I just can't believe that more people aren't recommending it. I think there's a lot of concerns about safety and doing it effectively. And I think a lot of physicians think patients are going to see the personal trainer. And believe me, we know that you can go and get a personal training degree in a weekend and go work in a Globo gym.
Mm-hmm.
And I am sure that, I have seen it. I'm sure a lot of orthopedists have seen, some significant injuries from people that go to personal trainers like that and, get injured. But I think with the proper technique, with the proper coaching, the proper programming, rest, recovery, and with the proper load, you can really make a significant difference. That's why strength training works so well. And the type of training that we do is especially effective.
One of my biggest gripes with the medical culture in this country is my perception that most MDs are thinking one layer deep. So, okay, you just told this gal that she has arthritis in her back. Who doesn't, first of all? And you've just suggested that she become sedentary to resolve that problem,
Mm-hmm.
even though you know that that's not going to resolve arthritis. And even though you know that the deadliest thing you could do is be sedentary. So,
Mm-hmm.
doctor, yes, you're telling me the solution to this immediate problem. It's kind of a half-baked, dumb solution. But what about all of the unintended consequences? What about my body as a system and my life as a whole? How come you're not thinking about that? And this is across every medical field. I just had this experience yesterday. I went to my dentist appointment, and I can't help myself. I just kind of like to see how people think. So I used to have an appliance that I wore at night for teeth grinding. So I asked about it. I was like, I was curious. That's made of plastic, right? Yeah. All right. Well, those things wear out, don't they? Yeah. You got to replace them every so often. Okay. Well, Where does all that plastic material go? Well, you ingest it. And for those of you interested in this topic, go Google, and Bree, put a link to this in the description. Go Google the chemical that's used to make plastic flexible. And then you tell me if you want that in your mouth. And then you tell me if you want to be ingesting that every night. No one I spoke to about it had even considered that. And so it's just, the human body is a multivariant system. It's super complicated. You affect one thing over here, it makes an impact over here. And yet I feel like the medical community is totally myopic. You come to them with a problem and they're just telling you specifically how to solve that problem, which may not work. And it totally does not consider the big picture. Have I had a string of bad luck, or do you find that that's commonplace in the medical culture?
I find that that's commonplace, and I find that physicians often underestimate the amount of influence that they do have with patients. So if you look at studies, for example, on back pain, a lot of times, regardless of what a person's MRI looks like, if they perceive that their imaging and their outcome is negative because a doctor, helps them to perceive it that way, those people go on to have, more disability, more chronic pain, than if a doctor says, "Well, you have this change on your MRI, but that doesn't equate to how you physically function. I think the best thing you should do is go out and get back at it,
Yeah.
and get mobile." You know, Australia is a country that does this pretty well. They have a lot of good protocols in place to get people up, get people active, and really focus on when patients have injuries, getting them out there again and really focusing on the function rather than what their imaging says. I have so many people that come into me and, feel that they're going to break their spine if they move 2 inches because they have this terrible, finding on their MRI.
Yeah.
And that's just not the case. We often have things as we age. If you do MRIs on most older people's shoulders, they're going to have some rotator cuff tears or partial tears, things like that. It doesn't in any way to equate most times to how they're functioning.
Who cares?
And they wouldn't even know about it if you didn't MRI the shoulder.
Sure.
Yeah. And so I think we're in this age where people that don't pay enough attention to their health, or they're hyper focused on it, and they latch on to all these little things that really don't necessarily mean much.
Yep.
Now, there's a lot of gray in medicine. You can have the same injury as me, and we can have totally different responses. But I think
outside of surgery, I think it's all gray.
Mm-hmm.
I think everything's on a continuum of probability, and there's not much certainty in the practice of modern medicine. There's not, but we pretend that there is.
Yeah, it really isn't. And if you're going to a physician all the time expecting to have a concrete 100% answer, this is going to work for you, that's probably unrealistic.
Yep.
But this is where if you have a good general practitioner, I think it's a good thing. General practitioners hopefully have a relationship with you and can see you as a whole person and kind of know your risk tolerance, know when to push you, know when to kind of draw back. I think that's where things can be useful. But at the same time, I'll say it time and time again, if you can prevent a disease from happening, before it starts, that's much better than having to deal with a disease once you get it.
No doubt about that. And unfortunately, most of us, especially as we're young, don't really understand what it means to be unhealthy, and we take our health for granted. And we make decisions that reflect that we're taking our health for granted. And the body's so resilient, it can withstand all kinds of abuse for years and years and years and years and years. But then eventually you got to pay the price. Eventually there is a price to pay for having bad habits. And it's not that complicated. It's like any other machine, just a biological machine. You've got to use it in the way that it was intended to be used, and you got to provide it with the fuel that's required for it to run optimally. So using it the way it needs to be used is moving it around. Since it's biological, it needs stress needs to be applied to it. It needs sleep and recovery. It needs good nutrition, and I think that would solve the vast majority of health problems if we got back to basics. Not another drug.
It totally would.
Yeah.
Yeah. Sleep, nutrition, and doing the right kinds of exercise 85 to 90% of the time. And I think that's where most people, go wrong, is we lose that consistency because life gets in the way. And you really, really have to prioritize those things if you want to maintain good health throughout your life.
Yeah.
We can't change our genetics. We can't change bad luck. We're going to get injured. We're going to get ill. But I think the key to maintaining your health overall is those three things. And you need to do them consistently. And really, there is no quick fix in medicine for any of those things. That's developing good behavioral habits is really what health is all about.
Yeah. Yeah. The health starts up here with your understanding and
Mm-hmm.
your commitment. And then it percolates down from that point. Megan, I think it's kind of cool that you're a runner. I think a lot of people have a misconception that we're anti-running, and
Mm-hmm.
I don't think we're anti anything. I think that we are clear about what is useful for gaining strength and what is not. Um,
Mm-hmm.
but if you're already strong and you enjoy running and you do it in a low impact way, I think that's great. I think that that conditioning work is important, especially once you're at the numbers that you're at, Megan. I think in the early days, time should be spent getting to the level that you're at strength wise, and then once you're strong, keep your body mass, lean body mass in check, or rather your overall body composition in check, body fat percentage in a reasonable area, and give those heart and lungs some work beyond just a heavy set of 3 or a heavy set of 5. Can you tell me about your running habit and what you do and why you do it?
Mm-hmm. So that's the one thing I told my husband when I started training. I was like, I'm not giving up my running. I love it. It still decreases my stress more than anything.
Nice.
I still try and run about 3 days a week. So I lift twice a week. I try. I don't run near as far anymore. I'm not running any half marathons. 3 to 4 miles is usually all I'm doing at a time, basically because that's all I have time for. And I'm a lot slower, but I'm doing it more for enjoyment. I'm not necessarily training for any race. But I do think it's important once you're done your NLP to add in that cardiovascular conditioning component. If you look at all-cause mortality, your VO2 max, the amount of oxygen you're able to kind of consume and your muscles can use, is also an important predictor of all-cause mortality. And again, I think from a metabolic standpoint, having good cardiovascular conditioning is important. And doing that with strength training is the best thing for your body. So I think overall, I would advise anyone to do it. And I do think it's important, especially if you have some body composition goals in the future. You want to maintain, a certain amount of fat mass to lean muscle mass, things like that. But I would always encourage people, if they're trying to lose weight, to develop a good overall base of lean muscle mass first with strength training. Because I can tell you, once you do that, you're so much more metabolically efficient in terms of utilizing excess calories, having a higher basal metabolic rate, that it's going to be easier to make minor tweaks to your nutrition or do a little bit of extra conditioning and actually see some more positive weight loss, I guess.
Sure. Yeah, and we could debate about the best forms of conditioning, but my take as a coach and as a trainee is, if there's something that you do outside of the weight room that gets your heart and lungs pumping that you enjoy, go do that. Go do that. As long as it's not overly stupid and is going to cause you significant problems. But running certainly doesn't fall into that category. And running's a good time. If you want to get your face out of the screen and just kind of push through the discomfort and find like a nice meditative flow state rhythm, clear your head, do some thinking, to put on the shoes and go for a run is a good time. Are you slower now because of the body? I'm assuming you gained some body weight. Is that why?
I've gained about 15 pounds.
Nice.
since I started.
Yeah.
So I started, yeah, I think I was 168 when I started. I had just had my kid a month before. For a hot minute, I got down to 160, which was my pre-pregnancy weight, and then I gained it all back again within a couple months.
Yeah.
And then I have not seen the 160 since. So
Talk to me about that. How do you feel about your body weight and for yourself and in general on the topic, especially for women, and your you know your shape and your body composition now that you're strong?
sure. It was different. I wasn't expecting it in all honesty. I think I was pleasantly surprised, but also a little concerned. I was not expecting to gain as much weight as I had. I can tell you I'm still the same size in terms of clothes. And so that makes me feel good,
Yeah.
I guess. Certainly, if you want a bigger booty, deadlifting and squatting is where it's at. Uh, I don't understand people that want a Brazilian butt lift. My gosh, all you have to do is deadlift and squat for a little bit.
Yeah, shit. And the fat they put in your cheeks ends up running down your leg and into your ankles, apparently. That sounds,
Yeah,
don't get me wrong. I'm not
it's
up to speed on the
crazy.
latest tech, but this just seems insane to me.
No, it's crazy, and
Yeah.
plastic surgery is so common these days. I mean, the procedures have just skyrocketed because everybody wants a quick fix,
Sure.
and it's just beyond being gross. It's just not tenable,
Yeah, shit. You're going to have someone put you in a medically induced coma, pay them thousands of dollars to change the shape of your butt. When you could just go do something that's good for you that also changes the shape of your butt as a nice side effect. Fuck.
Correct. Yeah. It seems so logical, and yet people don't do it.
Yeah.
But yeah, I mean, I think you're not going to get super muscly. I know that's probably the most common thing I get from my female colleagues is I don't, if I lift big time weight, I'm going to gain too much muscle and look too big.
Yeah.
And it just irks me to death, because to me, that's like leaving health on the table. That's like saying, I only want to be 75% of my, absolutely healthy and settle for, a lower lean mass and a lower bone density because I don't want to look big. And I just think, I don't think I look big. I wish I had more definition than that. I don't think I think my shape has changed, but I don't think I look any less feminine, I guess.
Yeah.
I think people a lot of times are when they're saying that, they're thinking of women that are, taking some extra substances to look really muscular. You have to work really hard on that, take some extra things and lift a lot of weight to look like that. And I don't think that's what anybody's going for. Yeah. I always tell my colleagues to look at our coaches, look at videos of some of the women that we have in the gym that are coaches.
Yeah, shit. Look at Kamisha or Gretchen or any of these gals.
Yeah. They look great. They don't, they look feminine and they're fit.
Yeah.
They're really, really fit ladies.
Yeah, that objection is kind of like saying, I'd clean up my diet a little bit, but I just don't want to get too lean.
Mm-hmm.
It's like, that's not how it works, silly. You're not going to get to 6% body fat if you cut your carbs a bit and eat lower fat. That's just not how it works. I'm sorry. And I know you have this extreme conception in your mind, but I'm telling you that you don't know what you're talking about. And I do. So you can decide if you want to listen to me or not. If you don't want to listen to me, just look at the case studies on the YouTube channel and talk to the members. But don't know what to tell you. All right, Megan, show us those traps. What do we got? Pull the hair back. Can we see those traps? Let's see how masculine you've become here.
Oh, gosh.
Look like a normal girl to me. Shit. All right, biceps. Let's go. What do you got? Ugh, look at that disgusting muscular arm, Megan. You've clearly.
I know. Terrible, isn't it? So
All right,
much definition.
That's a scientific study with a doctor, my friends. We've just proven that unequivocally. How old are you, Megan? And what's your height, by the way? We should get that out of the way too.
So I am 41 and I'm 5'7".
5'7", and what's your current body weight?
177.
Nice. I'm glad you're willing to share that, and I like to share that when women come on the show, just because you know how much work we have to do. You're in the gym all the time as far as dispelling body composition and body weight misbeliefs. So we've got a lot of work to do. That's the theme of this episode, Megan. We have some information and some evidence that is contrary to what most people believe. It's especially it's especially negative and troublesome in the medical field. And it's especially negative and troublesome for half the population, which is women. Especially those of whom have gone past menopause and need this the most. So what do we do about that, Megan? Do you have any ideas for me? I'm supposed to be doing this marketing stuff now for the Gyms Company, and we're organically growing, and the message is spreading. We're doing the podcast, we're sharing videos on our YouTube channel. A lot of times, I feel like we're just talking to ourselves, even though things are kind of slowly growing. What do we do?
I think if you are stepping into a starting strength gym, you're already well ahead of most of your peers. So for people that are coming to our gyms, you're already on the right path. I think regardless of your age, people can benefit from strength training. I think we just have to, I think we still, as our gym at Columbus, we still get most of our clients by referral. But I think if we can have more and more people talk about their experiences, talk about the benefits they've had, and if we can, and I guess this is my job, is to talk to more medical professionals about, and just educate about what the benefits are. Because I think a lot of people just honestly don't know, or they've forgotten, or we studied it for 2 seconds in medical school. I think we just need to drive more and more people to this place. But if you get into a starting strength gym, I think you're already, heads and tails above the rest of your peers.
Yeah, excellent. Well, I will be in Cincinnati. You saw my email in a couple of weeks. So if you have any members that you'd like to highlight on the channel, I'll bring my camera and we'll get some case studies going.
Yeah.
And then when it comes to spreading the word in the medical community, if you can think of any specific actions we can take on that, let me know, and I'd like to be involved, including, by the way, you seem awfully busy. You're a professor, a doctor, and a gym owner, and a mom, so you probably don't have too much spare time. But in any case, I do think it would be outstanding to get in front of a group of medical professionals at a conference or in any educational format. And however we spread the message, I want to start spreading the message more. I would love to get to a point where your PT, after you're done with the nonsense you're required to do for insurance post-surgery, and also your medical doctor, after your blood panel comes back and your BMI is shit and the sedentary lifestyle is making you pre-diabetic and you're on the wrong track. I'd love it if the next recommendation was not to go to the pharmacy, but to go to a starting strength gym. And even if it's not us, to go, it's like, even if they just said, go find a safe way to lift weights, do that 2 to 3 times a week, don't ever miss a week, and add weight when you can, and keep your reps on the low side. Even if people are doing that on machines, that would be so much better than what they're doing now. Would it be optimal? No. Do we have a better way? Yes. But it would be nice if things evolved towards that, so that when when a medical or when any professional gives you a recommendation, but it's totally generic in nature, and they don't have any idea what they're talking about, they're just parroting what they've heard. It's just stunning, right? So it's like, oh yeah, you need to go do resistance training 2 days a week. Okay, how? And then it's kind of like blank stare. It's very, very similar to a conversation I had with a doctor I bumped into at a bagel shop a couple of weeks back. And you have to forgive me, Megan, but I like to just bring up topics that you're not supposed to bring up, because it's really interesting for me to just watch people's reactions. So I asked this gal, like, hey, so what do you think about childhood vaccines? And she looked at me like I asked her if the earth was flat. And I said, and she said, oh no, they're great, and they prevent disease, and you should take them. And I said, yeah, no, I understand what the story is. I'm just curious. Like, so for example, hepatitis B. Can you think of a reason why I should give my daughter the hepatitis B vaccine? So it's interesting when you peel the layers back. And by the way, Megan, I know that you enjoy learning things, and I know the audience does too. I'm reading this book called Turtles All the Way Down, which is an investigation. Apparently, it's anonymous criminal investigators from Israel that dared to look at the way vaccines are studied and brought to market. and it's pretty interesting. So we'll link to that in the description too. I would love to hear your input on something like that. And I've got a post on the forum on this topic because unfortunately, I'm not in a position where I'm willing to trust anybody I don't know, especially not a bureaucracy and especially not a random person that has a title, because I do my best to avoid credentialism. So I'm certainly not just going to blindly trust the CDC schedule for childhood vaccinations. So I'm doing my own research and I'm finding that it is a minefield. It's an absolute minefield. And the dissenters, whenever there's a dissenter that cites data and has good arguments, I always go to find the counters to their arguments. And the interesting thing is I only find smears about their character, never the counters to their argument, especially Dr. Sears. So yeah, I no need to respond unless you want to, but this is just a fascinating topic for me. And I love how what we do impacts health overall. And I'm just fascinated by the way our culture manages people's health and all of the incentives that exist and the structures that exist and the system that's in place. And I find it all very bizarre, fascinating, somewhat disappointing, and in some cases encouraging, as you've mentioned at the beginning of the show. Bree, please link to the forum post where I wrote a forum with the subject, Forbidden Conversation, Childhood Vaccination. And Megan, I have a few thoughts that I've shared in there. And I'm just trying to purely look at this from an objective point of view. Like if I'm an alien that landed on this planet and there's a standard way of doing things, I'm just trying to verify that way of doing things is optimal, you know? I would love your opinion on that. And I would love to be educated if I'm missing something, because this is a critically important decision. I can't think of anything that's more important, you know? So yeah, I'd love your input. I've got one more question for you on the medical stuff, and then I want to ask you about gym ownership. What's the curriculum like in college? Is there stuff that is clearly not true that the staff is being requested to pretend is true? For example, I guess, is the curriculum where it needs to be, or do we have as many flaws as I think we do in the way things are being taught?
So I do teach about 25% in the medical school. So, so I know a little bit about the curriculum. I think there is so much to medicine. It's hard to get it all in. So your first 2 years of medical school are typically just book learning, learning about diseases. And then the second 2 years are typically learning from patients on the wards. But, there are diseases that I remember learning like literally one line on in medical school, and I will have patients that come in with that disease. There are diseases like cardiovascular disease that you spend, weeks to months on. But overall, medicine is a life learning subject. You kind of have to continue, and it's on the onus of the physician to kind of continue to read and look up things and, bring in their clinical experience as to how they would treat patients. I think you can give, even though you teach some physicians the same knowledge, I think you can give them a patient later on and they can come up with two totally different interpretations of what that patient has and how to treat them.
Sure.
And
I watch House, I know.
That, yeah. and that's largely because there is so much gray in medicine.
Sure.
And I think the interpretation of even some of the data that we have, depending on how you're looking at it, can be very different.
Depending on how it was collected, if we're being honest.
Correct.
Yeah.
And which articles you decide to trust versus not trust, and which kind of avenue you decide to take. So I think that's where patients are often frustrated and where there's often, not a set answer. And that's why I think, I want my patients to do their own research. I'm happy when they ask me questions, and I will give them my honest opinion, even if it's an I don't know,
Yeah.
That I just don't know enough about that topic. But I do think from a curriculum standpoint, I can tell you most medical schools are just overwhelmed. There's just not enough time to teach the students everything and also keep up with all the other things that we need to do, like their personal days and time off, and making sure their, you know, mind, body health is sound, but then also, getting in their need to interview patients and, being able to talk to people appropriately. There's just so much.
Sure. Sure. There's a
You
lot to
could
know.
spend 10 years in medical school and not know everything.
Yeah. Yeah. All right. Fine. I'll be more direct with my question. I'll cut to the chase, Megan. Does your school teach that there are two distinct biological sexes that cannot be changed back and forth?
They will teach a difference between biological sex and how people identify.
Okay, good,
Put it
good, cool. That's sound. The lines seem to be blurring. We seem to be moving into territory where people literally think or are saying that you can actually change your sex, like your biological sex.
Yeah.
So, okay, good.
But that's how we try and define it.
Yeah, that's comforting. Thanks for telling me that. All right, let's end on a happy note, Megan. You can tell my skepticism and displeasure with the medical community is an all-time high. So, pardon my uncomfortable questions. This one will be fun. Tell me what it's like to own Starting Strength Columbus.
Oh, it's great. That's great. I would highly encourage anybody, if you're interested, to do it. I think, the best thing for me is that I get to see people that actually care about their health and they want to get better. And you get all the good feelies when you own a gym, because you see people actually changing their lives and, getting better and functioning better. And then they bring in their families, and you get to meet everybody in the family. And that's the best thing, is the community that you have, and you get to build that up, and you get to kind of run the gym the way you want. And I think it's just great. It's always something I can get behind, is helping everybody to, achieve a better health outcome. So
I never put it in those words. I never thought about it like that. That's a great point. Yeah, in the medical field, we don't get a whole lot of joy out of seeing people get better. That's not our average day. But in the gym, you're seeing people get better every time you see them, and you're seeing people make the right choices. No wonder why I like coaching more than I like riding on the ambulance.
Yeah,
interesting.
I mean, I think that's my biggest thing. Probably the biggest, problem with burnout in our jobs is, people come back in with the same old thing, same damn thing every time.
Yep.
And they don't make the changes, they don't get better. And, you just get a little numb to it after a while. It's nice to see patients or clients, whatever, that are taking control of their health.
Yeah. One of my biggest problems is, I sometimes care about people more than they care about themselves, and that causes conflict. And if it's a stranger, that's totally inappropriate. If it's a loved one, it's a matter of just having tact and knowing when to push and knowing when to let off. But yeah, it's nice to be around a bunch of people that understand what it takes to lead a healthy life, and are happy to put in the work for the long-term benefits of the work that they're putting in. So it's rewarding to see that every day. And I know Pete loves it. Pete's a great guy.
Yeah.
You've got a good husband over there. You guys are cool crew. I'm bummed I can't visit the Columbus gym, but I'm looking forward to seeing you guys, hopefully, if you want to come up to Cincinnati when I'm there.
Yeah, I hope so. I hope I can make it. So.
Awesome. Well, how can people get in touch if they want to watch you lift online or want to send you a message? Do you have social media? What do you want to share? Yeah,
so Megan Lifts on Instagram. You can always find me there, LIFTS. I'm also on Facebook. I also am part of the Starting Strength Columbus page. So a lot of times I'll be on there. But...
Cool. Anything you want to mention that I left out?
I don't think so.
All right. Well, thanks for coming on the show. I always enjoy these conversations because there's a lot of stuff I'm confused about. So I like to get the perspective of someone that's in the thick of it and can hopefully make me feel better or reinforce one of my conceptions, and then I can do with that what I will. So appreciate you humoring me, Megan. And yeah, I'll see you in Ohio.
Sounds good.
All right. Thanks.